Welcome back to Therapy Thursday. Our last two blogs have focused on a phase 1 and phase 2 approach to how we treat Achilles tendinopathy. Phase 1 was more about pain analgesia or pain control. Phase 2 was about trying to actually strengthen your Achilles tendon. In phase 3, we start to progress you more towards the demands of your particular sport. This phase is called energy storage loading, and it's meant to mimic both the volume and the intensity of the specific demands of your sport. Check out some of these examples of exercises that would fall under the phase 3 category.
So as Dave goes through a progressive warm-up here, we're going to go through a few main points about the energy storage loading phase. Chief among those is the point that this phase is reserved only for those trying to return to play with sports that are demanding, and it's the therapist's goal to match the demands of these exercises to that particular sport. The overarching goal is to increase the load tolerance on the tendon and improve power to progress to return to play. At this point, Dave is generally warmed up, and he's progressing to two-legged skipping. I wanted to slow it down to show you how disgustingly large Dave's calves actually are, and we looked it up. It's actually not a known risk factor for an Achilles tendon rupture or anything, so he's fairly safe. Exercises like the modified running A seen here, and even the side-to-side ladder hopping seen here, are generic multiplane exercises that we like to incorporate. We also like to use some higher intensity exercises like a tread sled push seen here. Recall that the whole purpose is to match the demands to the particular sport, so this would be important for somebody like a sprinter or here in a more jumping-oriented sport. An example of the difficulty in matching the demands of phase 3 with one's particular sport is when reviewing the literature, we found one article citing that the average volleyball exposure has 300 jump lands, meaning each practice and each game the athlete is subjected to 300 lands. It's difficult to match this in an environment like a gym, but we do our best. Now, because this is the most provocative of the 3 phases, it's only recommended that you utilize this every 3rd day. That's loosely based on the 72 hours it takes for collagen to respond to load. Additionally, there are certain criteria that athletes are meant to match in order to progress from phase 1 to 2 and 2 to 3. This is a recommended 4-day routine that the athlete should utilize once they reach phase 3. Once the athlete reaches return to play, it's still recommended that they maintain their strength via phase 2 exercises at least twice weekly.
We hope you enjoyed our 3-phase approach to treating Achilles tendinopathy. We've gotten a lot of positive feedback on our Therapy Thursday blogs, but one of the things that people are asking for are more individualized approaches and progressions to their specific injuries. We're going to try to mimic this in the future, so stay tuned to further Therapy Thursdays.